Hi, my name is Renaldi Pramudia. I'm a cadet from PPI Churu. I'm from ATC Course 26. I live in Tangerang, Indonesia. Today I want to talk about corona pandemic that happening right now in every country, everywhere, including Indonesia. What is coronavirus? What kind of disease it is? Coronavirus disease, or as we know as COVID-19, is an infectious disease caused by a newly discovered coronavirus. Most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. Where do coronaviruses come from? Coronaviruses are viruses that circulate among animals, with some of them also known to infect humans. Bats, the animal that fly on the night, are considered as natural hosts of these viruses, yet several other species of animals are also known to be a source. What are the symptoms of COVID-19 infection? The virus can cause mild flu-like symptoms such as fever, cough, difficulty breathing, muscle pain, tiredness. More serious cases develop severe pneumonia, acute respiratory distress syndrome, sepsis, and septic shock that can lead to death. Is there a treatment for the COVID-19 disease? There is no specific treatment for this disease, so healthcare providers treat the clinical symptoms such as fever, difficulty breathing of patients. Supportive care like fluid management, oxygen therapy, etc. can be highly effective for patients with symptoms. Are face masks effective in protecting against COVID-19? If you are infected, the use of surgical face masks may reduce the risk of you infecting other people, but there is no evidence that face masks will effectively prevent you from being infected with the virus. In fact, it is possible that the use of face masks may even increase the risk of infection due to a false sense of security and increased contact between hands, mouth, and eyes. There are currently no vaccines against human coronaviruses, including the virus that causes COVID-19. This is why it is very important to prevent infection and to contain further spread of the virus. The development of vaccines takes time. Several pharmaceutical companies are working on vaccine candidates. It will, however, take months or years before any vaccine can be widely used, as it needs to undergo extensive testing to determine its safety and efficiency. How can I avoid getting infected? The virus enters your body via your eyes, nose, and or mouth, so it is important to avoid touching your face with unwashed hands. Therefore, washing your hands with soap and water for at least 20 seconds or cleaning hands with alcohol-based solutions, gels, or tissues is recommended in all settings. It is also recommended to stay 1 meter or more away from people infected with COVID-19 who are showing symptoms to reduce the risk of infection through respiratory droplets. That's all from me. Stay safe, always wash your hands. Help the doctors with stay at home so the virus won't spread anymore. Stay at home. Thank you.